Good morning, afternoon, or evening, everyone. We're from Small Group Discussion B10, and today we're going to present to you our literature review, which is titled The Effect of Antibiotics for People with Hepatic Failure. Before we start, may us introduce ourselves, starting with me. Gusti Ngurah Tata Adityawarnam, with the student number of 2002-511215.
My name is Bagus Gede Kinandanamas Manuaba with the student number 2002511210.
My name is Dewa Sari with the student number of 2002511211.
Hello, my name is Kurniati Atmaja with student number 2002511216.
Hello, my name is Bagus Agung Suputra Arya Nugraha Sutanegara with student number of 20025111219.
Hello, my name is Putu Maharany with student number 20025112220.
Hello, my name is Sharita Partiwi with the student number 20025112221.
Hello, my name is Natasha Repusparani with the student number of 20025112227.
Hello, my name is Joshua Francisco Sofian with the student number 20025112229.
Hello, my name is Krisandra Tramdarjo with the student number of 20025111230.
So my name is Timothy Julian and my student number is 20025111233.
Perkenalkan, nama saya Arya Clara Budiman dengan 3 digit tim terakhir 234.
Hello, my name is Amanda Raisa Suryananda with a student number of 20025111237.
So antibiotics are the low molecular weight microbial metabolites at low concentrations that inhibit the growth of other microorganisms. Because of the ability of these microbial metabolites molecules, antibiotics are being used to treat infections and are also associated with the reduction of morbidity to save lives. There are a few different ways of classifying antibiotics. However, the most well-known and standard classification depends on their molecular structures, method of action, and also the spectrum of movement of the antibiotics themselves.
So the liver is an organ that is important in various physiological activities in the body, such as metabolizing macronutrients that have benefit in providing energy, regulating blood volume, playing role in the immune system, and breaking down compounds contained in several drugs and others. In addition, the liver can also function to store glucose in the form of glycogen by collecting glucose through the glucogenic pathway. In the metabolism of amino acid and the primary handlers of protein, the liver plays a role. The processing of amino acid form in use as energy for the body, and the removal of nitrogen and protein degradation is excreted from the body in the form of urea metabolism.
Problem formulations. How do people with hepatic failures metabolize drugs? What are the antibiotics that can be prescribed for people with hepatic failures? What are the antibiotics that cannot be prescribed for people with hepatic failures? And what is the dosage of antibiotics for people with hepatic failures? Moving on. Objective: to have better knowledge on the effect of the antibiotics for people with hepatic failures, specifically on what can be prescribed and not. Then serves to give a better understanding of antibiotics and hepatic failures. More information is obtained through researching and reading journals, and writers may increase their teamwork and cooperation skills.
Next, moving on to drug metabolism. Metabolism is characterized as the assortment of complex biochemical cycles that living cells use to create energy and keep up their development and endurance. Metabolism includes the amalgamation and breakdown of glucose, unsaturated fats, and amino acids, the age of energy, which is ATP, and oxidative phosphorylation.
Drug metabolism is the metabolic cycle where the substance, structure, or parent compound of medication is changed over into metabolic to end from the body. The top destinations of medications digestion are the gut and the liver because of significant metabolic proteins in these tissues.
Drug metabolism and hepatic failure. The liver is the essential site for drug metabolism. Several things, such as end-stage liver disease and liver cirrhosis, can alter drug pharmacokinetics. The primary alterations is caused by decreased clearance, leading to accumulations of drug and adverse drug reactions. Poor drug clearance occurs by the change in plasma protein bindings and enzymatic activity. Albumin synthesis and other plasma protein take place as hepatic function decrease. There are two types of hepatic failure: chronic hepatic failure and acute hepatic failure.
So today I'm gonna explain about what's the difference between acute liver failure and chronic liver failure. The point is, if it's acute liver failure, it happens briefly, so it occurs on a brief moment and it causes a severe damage. Meanwhile, if it's chronic liver failure, it's because of progression of the damage and the accumulation of the damage, so it happens more slowly. So acute liver failure is a rapid loss of the liver function. This condition can occur in days or weeks. Commonly, acute liver failure takes place in a person who has no pre-existing liver disease. This condition commonly originates from the hepatitis virus or drugs, such as acetaminophen. Meanwhile, chronic liver failure develops more slowly, as I said before, caused by a virus, drugs, or alcohol abuse. The damage to the liver cannot be cured or irreversible.
Okay, so now I'll be explaining antibiotics and hepatic failure. Drugs used for patients with hepatic failure are limited, specifically the use of antibiotics. This limitation is because antibiotics can worsen the condition of the patient. The following is a list of antibiotics that should be avoided for hepatic failure patients. First is amoxicillin clavulanate. Second is antibiotics macrolides. Third is antibiotics lucloxacillin. Fourth is antibiotics sulfonamides. And the last is antibiotics nitrofurantoin.
Hello. Patients with hepatic failure also can be prescribed with penicillin as their drug of choice. Benzylpenicillin and phenoxymethicillin have rare occurrence on causing liver injury, but oxypenicillin such as flucloxacillin, oxacillin, dicloxacillin, and cloxacillin are hepatotoxic drugs. The patient should be aware if using this type of drugs. Patients with hepatic failure also can be prescribed amoxicillin. It is an aminopenicillin that can treat mild to moderate infections. However, there have been cases that amoxicillin can cause liver injury after these antibiotics is stopped. Amoxicillin type that should be aware of is a combination of amoxicillin and clofinate.
Okay, so I will explain the dosage of antibiotics in hepatic failure. Some drugs can result in which could develop into hepatic failure. Liver injury pathogenesis is related to direct hepatotoxicity and idiosyncratic reactions of drugs. The injury mechanisms are based on the assumption of the clinical presentation and hepatic histological findings.
Penicillins and cephalosporins are widely used antibiotics, even though cephalosporins can cause self-limited transaminitis, whereas penicillins can cause subclinical cytolytic liver injury. Despite the statistically insignificant different dosages, such difference was consistent for each cephalosporin. Next.
And for the last part, I'll conclude for today's presentation. So the liver is an organ that is important in various physiological activities in the body. such as metabolizing macronutrients and its function to metabolize drugs. The use of antibiotic used by general practitioners can cause extraordinary side effects and can cause hepatotoxicity. In some cases, the cause of hepatotoxicity is unknown, but it can also occur due to immunologic reaction and hepatic metabolism. But sometimes, the use of antibiotic can effectively reduce bacterial infection and the risk of death in patients suffering from cirrhosis with acute chronic liver failure as a prophylaxis.
Patients with end-stage liver disease and cirrhosis hepatis can change the pharmacokinetic. This is caused by the accumulation of the drugs and component drug reaction include poor drug clearance. The dosage of antibiotics that can be given depends on the patient disease condition. The limitation of using antibiotic as prophylaxis must also count the risks and benefits of using this antibiotic.
Here are the list of references that we use in making this literature review, hence concludes our presentation for this evening. I don't know who's having a birthday, but yeah, that's it for today. Thank you very much for watching. Goodbye. See you later. See you later, boys. See you later. See you later, boys. See you later.